my dear friends. Today is about a case that I will call, like breaking news, something that has created an impact in my life, in the way I start working with resoption. Because in 2012, I treated a patient that I'm going to show it to you. But when you see this image in the video, how the cells prepare after a trauma, the whole body becomes active to repair immediately the problem. In the case of a bone fracture or a tooth fracture, it happens the same way. The cells from our vascular system, they come and create multinucleated cells, the way you're gonna see it right now again. And the vessels get out monocytes and they get differentiated, and they're so intelligent that they know the amount exactly of calcium, of growth factors, hydroxyapatite, all the components, how they're gonna move that elements to have the bone remodeled. So the osteoclasts come and destroy bone because they wanted to bring the new back. And when you see a kid that it repairs itself so quick, it's because at that age, the immune system is so perfect that immediately repairs the damage. So kids have a fracture in the leg and it will be quickly repaired. However, an adult is slower, and that's when the woman comes to the osteoporosis and everything slows down and the bone formation. So in the kid, what this has to do with the teeth, I want you to keep this image in your mind and remember that if you have a trauma on the tooth, the blood vessels of the oral system, in this case it comes from the whole body, give instructions, go to the tooth area and start creating all this amount of decisions. They come, the boss cell, and said we need to go to this place and destroy to produce new bone. The difference is when you are in this area, the cells don't know how to stop. They just know they have to go to this place of injury and create more cells to produce the repair. This is the problem. If you have a big trauma or you have, let's say, braces, and the braces are very tight, take an anti-inflammatory, talk to your orthodontist, let him know that you are very aware that root resorption exists and you just want to be sure if this is one of the risks, because I see many patients that they are in adult age and they go to have Invisalign or they have to do braces. Please ask your specialist what are the consequences of me applying these forces and moving the teeth and how you're gonna handle it. Now, this is the revolution that I want you to know, because in the patient that I'm gonna introduce to you impacted me because there are 3 teeth that they were gonna be extracted. These front teeth of these patients, like you see it, they were ready to be extracted until somebody told him that I will be the only one who will be able to determine if the teeth will be safe, which was very nice for me. But what I mean is important is I want everybody understand that root resorption is not the end of the world and you do not have to take the tooth out. I've been working in this since 1995 in my research during the PhD and continue doing it during my office, applying all the knowledge and getting new information. And until today, this resorption that you see here, this hole that you see around is destruction. The tooth should be all formed, and this one too. But the patient when he didn't want to have a CT scan, because these cases need to have a CT scan, where we're gonna see the different parts of the root, how much the resorption is, how external is, how weak is the root, how weak is the tooth, how strong. But he said, I don't care, doctor, I trust you, please open it. Let's try to do it before the CT scan. I took the risk, I did it with him, and we have, after more than 10 years, the patient is very happy. We place MTA in all the root and then a resin, and then he went to see his dentist to have his final restorations. And I was seeing the patient every 3 months. So when it became our year anniversary on 2022, He came again. I must have the x-ray, but he comes in 22 and he's the same. And I'm concerned about these areas. But the difference is today, the patient said, I'm gonna listen to you and I will do a CT scan. And I'm very proud to tell you that he actually, when he bring the CT scan, we were able to see that the resoption still was sealed perfectly. The report doesn't show any problems. The patient doesn't have any mobility, and he still is really happy with the results. So the CT scan confirmed to me, imagine, I was very happy because it's 12 years. It's gonna be, it's 12 years because it was 2012, and he's still happy. He's gonna come for 2024 follow-up. But if you hear about resoption, in this case it happened that it was only internal, but it was extremely advanced. So I hope you like this episode. If you have any questions, give us a call. You can send us your comments and questions through YouTube, Instagram, and TikTok. Thank you.